there's a lot of things that go into basically how we experience pain, and science is helping us to really uncover that it's not always what you find on an MRI that is causing your pain. And so that's a good thing that we're starting to realize this. And this has been, at this point, decades that there have been these studies out, but it's still not something that is commonly talked about, because when we have pain, we go to the specialist, and generally the specialist is, going to try to help us in whatever perspective that they have. And if surgery is the way that they fix things, or that they will try to help you, then you will get surgery if that's something that you're interested in and that you want to do. But the more and more research studies are showing that when you have a herniated disc, within 6 months, you can get over 50% reduction in size of what that disc was bulging. And even more on top of that, which just kind of like blows my mind, is that, in these studies, they found, that someone had a herniated disc, they had conservative treatment, they had improvements in their symptoms. They then took the MRI again in 6 months or a year to see, okay, like how much better has this disc bulge gotten. Over 80% of people have at least 50% reduction in the size of the herniation. There wasn't a great correlation between the improvement in the herniation and the symptoms. So people were feeling better, but not necessarily always getting, a decrease in size of the herniation. So let me just repeat that. People were feeling better, but their herniations weren't changing. Same deal. People who didn't have any pain, no limitations, had MRIs, and they showed disc herniations or slipped discs. They would have never known it had they not gone and participated in this research study. So it's just kind of a challenge, right, to you and to your healthcare providers and to us as, healthcare professionals, that imaging, while very helpful and necessary, does not always tell you why you're in pain. And it's something very easy to fall back on as a patient and as a provider as well, to say, okay, let's go get you an MRI. But if you have nothing to compare that MRI to of, a year ago, 6 months ago, 2 or 3 or 5 years ago, then you don't necessarily know that you didn't already have what was ever on that MRI. And, today we're talking about discs and disc herniations and slip discs. But this goes for a lot of other things. I see this as well happening with rotator cuffs, which we'll do another video on that separately. But it's something that we want to think about. And there's a lot of kind of fear around, oh no, I slipped my disc. Oh no, I herniated my disc. I'm going to have surgery. The majority and many different research studies have shown that through exercise, conservative management, physical therapy, specific exercise, that you can heal your own disc without needing to be cut open. And it should be very reassuring whether you want surgery or not, because you have the potential to improve without surgery. And I'll note that there was one research study I was looking at that specifically was looking at these really kind of wide and large lumbar discs discs, and they called them massive prolapses or massive herniations, and that those actually had the best potential to get better on their own. So a lot of things that we would not logically think that would go together, or a lot of kind of breaking the beliefs or challenging the beliefs that, well, if I herniated my disc, I'm definitely going to be in pain all the time. Well, that's not always true, and we have science to back us up with that. So in our next video, we will talk a little bit about maybe what are some exercises, what are some things that you can kind of think about doing if you do have a herniated disc. And if this is something that you're curious about, want to chat about, have a past history of, or just want more information, reach out to me. I love talking about this stuff. So I'm very happy to chat with you, and reach out.